efficient. Slide number 7. Another type of developmental cyst is called glandular odontogenic cyst. الفرق, the different feature of this cyst, it has glands inside the epithelium, and even it will form mucin. ولهذا sometimes الاodontogenic cyst developmental could have glands in their epithelial lining, but these are very rare. نجي على slide number 8. The glandular odontogenic cysts are rare. They have a strong tendency to recur because it has why? Because it has folds, multilocular. Treatment by enucleation if it was small. If it is large, no, it's difficult to do enucleation. Diagnosis, كل cyst diagnosis is by histopathological appearance, but some cysts like eruption cyst could be diagnosed by clinical features and an X-ray. Slide number 9. Calcifying odontogenic cyst. احنا قلنا بصورة عامة الcyst is a pathological cavity lined by epithelium filled with fluid and semi-solid material. معناتها radiographically it's radiolucent. Cystat كلها it should be, because it's a lumen فراغ, it's radiolucent, but دائما we have an exception. Sometimes we have calcifications within this lumen. It could happen. It's called calcifying odontogenic cyst. It's very rare, but we should take it in consideration. And as you see بالX-ray بالmaxilla إنه I even have resorption roots or displacement. Why? Because the growth of this cyst is slow, and it's يعني not only slowly growing, but it's يعني filled with يعني ايش نقول the growth of this cyst is heavy and very slow. That's why it's called eruption للروت اللي هي نحن قلنا dentin. It's very الorganic والinorganic substance بالdentin. It's الorganic slow بس low, بس inorganic is higher than the bone. ومع ذلك السيست قدرة ما بس تصير resorption للبون وإنما resorption للدنتين. معناتها slowly growing تشبه other types of lesion. Slide number 10. Histopathological feature of calcifying odontogenic cyst. There is something called ghost cells. We said ghost cells, they are cells that have no nucleus. This is the pathognomic features of calcifying odontogenic cyst. Every rule has an option. So نحن قلنا مثلا benign, anything that ends with oma is benign, except we have exceptions also here. Cyst is a pathological cavity lined by fluid filled with fluid or semi-solid material. Also, it could be filled with some types of calcifications. There is also exceptions. Take it in consideration. Slide number 11. Histopathological features of calcifying odontogenic cyst. Here, the basal cell layer has a pathognomic feature of ameloblastoma اللي هي reverse polarization, who also has satellite reticulum-like suprabasal cells. يعني يعطي consideration, and this could be ameloblastoma, this could be odontogenic keratocyst, it could be both. لكن the characteristic feature is ghost cells. They shed inside the cavity. They are ghost cells because they don't have a nucleus. slide number 12. الكي features. Odontogenic cysts are rare, but there is a wide range. Radiographically unilocular, but sometimes they could be multilocular. We see calcifications that may suggest its diagnosis. Yani if I have radiolucency with diagnosis, I could say it could be a calcifying odontogenic cyst. A histopathological pathognomic feature, I have ghost cells or ameloblast-like cells in the reverse polarization. Usually responds to enucleation, that's good. Solid lesions are distinct and more aggressive. Solid lesions معناتها has more calcifications. Slide number 13. We can see radiographic feature. Here we have an impacted premolar. If you see a radiolucency that surrounds the crown, نحن نقول this is a dentigerous, this is the pathognomic feature of the dentigerous cyst. It turned out that this pathognomic feature of a dentigerous cyst is not a dentigerous cyst. After 2 years اتبين انه الانlargement زادت, و this turned out to be carcinoma. So you cannot give a perfect diagnosis until after pathology. ولهذا taking consideration when you see something abnormal مع الباثولوجي يقول it's better to remove, بس not directly. Give follow up. يعني هذا البيشنت لو كنا عملوا له follow up not after 2 years, within 1 year they could have known its type of carcinoma, with treatment would be even better, will chances for survival would be even more better. When they لما يصير carcinoma معناته treatment surgery with other types of treatment, يعني radiotherapy, chemotherapy, adjuvant, hormonal therapy, immune therapy, aquacitaviral therapy. When it's benign, treatment it will be local. When it becomes malignant, treatment to aggressive, يعني surgery will not be enough. The patient should have a follow-up and other types of treatment. That's why early diagnosis is good prognosis. نيجي على slide number 14. As you can see, this type of patient caused a pathological fracture. How did this fracture? We have 2 types of fractures. We have traumatic fracture and pathological fracture. A traumatic fracture مثلا عندي patient يجيني young healthy تعرض لكار accident or something like that, تعرض لتروما كلش قوية وتسببت ب a fracture of the mandible. There was a heavy trauma that caused this fracture of the mandible or maxilla. لما يجيني patient هو healthy with some small pressure مثلا mastication or وجاني patient he has a fracture of a strong bone, I should take in consideration something inside this bone weakened the bone, it caused a pathological fracture. يعني there was a pathology inside the bone that caused this fracture. وكثير نلاحظها هاي الحالة موجودة. It could be osteoporosis, it could be cancer, يعني any type of malignancy, it could be high. So when you have an abnormal fracture, take in consideration إنه I take a biopsy, this action of biopsy could be a lifesaver. نرجع على slide number